Welcome back to the TND podcast. I'm your host Tishan,
And I'm Darwish.
and for today, the topic of today, we are going to be talking about cancer awareness among the youth.
That's true.
And today we have a very special guest with us. We have Mr. Amir Dawood, a fellow BAC student who studies UKD law, and he is a cancer survivor recently. So yeah, we're going to be interviewing him for this episode. And yeah, that is it.
Alright.
Yeah.
So, Mr. Imeh,
Yes.
could you give us like a bit of backstory about yourself, your name,
How old are you?
how old, type of stuff?
Okay, so a short introduction about me. Assalamualaikum warahmatullahi wabarakatuh. My name is Emir Dawood and I am 19 years old this year. And yes, I'm a cancer survivor. I was diagnosed with NPC cancer stage 3, nasopharyngeal carcinoma, last December. Yeah,
And as a friend, I want to say that you are a very strong person.
thank you.
I saw that your Instagram post, when did you post it?
I think it was about
About 2 months back.
yeah, it was 2 months back. So
Yeah.
I actually got completed my treatment in April.
Mm.
And I thought, let's give it a bit of time for me to heal myself and come back. So I posted it in July. I think if I'm not mistaken, it was about 18th of July, 19th of July, yeah.
Yeah, as a friend, it came as such a big shock to randomly see you post that, and this whole time you were battling cancer without a lot of your friends even knowing you were going through what you were going through. I'm sure we cannot imagine, especially as a college student. College life is already hard as it is.
Yeah.
Trying to do assignments and stuff like
But
that.
like, as shocking as it is for your friends, it had to be as shocking
Yeah,
for me.
yeah, that was a big shock for me.
Especially at your age, most
Yeah,
kids.
you're young. You're really young. Wait, how did, like, when you were told about it, right? When you got diagnosed,
Yeah.
what was the first thoughts? How did you feel?
Let me give a backstory of my journey. August, I went to Umrah. I went to perform Umrah.
Alhamdulillah.
And yeah, you see, God is very great. I had to go there, and He showed me something was not right with me since I came back, and it was just very fast for me, within 3 months. So, I went to Umrah in August. I got it from a virus called actually EBV virus. This EBV virus is very common among Indonesians. So when you go to Umrah, you buat tawaf, So you collide with you collide with many people. So you don't know who carries what kind of virus. So EBV virus is like a normal fever virus, but it attacks people who has very low immune system. And since small, when I was born, I have very low immune system. So it kind of like triggered in me. So that's why I had this cancer lah. But the symptoms for me was I was only down with fever, regular flu. But also since small I had sinusitis. So I didn't, maybe match or whatsoever thing that cancer causes flu ke, So one fine day, I spit a little bit of blood. It was actually December 3rd, on my dad's birthday lah.
Wow.
After I came back from the function. It was before. In the car, when I was going for his birthday party, I spit a little bit of blood. I knew something was not right at that point of time. So immediately, at the same function, my family doctor also was there. I went and asked him. So he said, you know what, come and see me next day. So I went and saw him next day. And I've been having that a lump here for about quite some time. Doctors told it was lymph node swelling. Nobody could identify that it was a tumor, lump or whatsoever. Doctor suggested to do biopsy, but I kept on prolonging it because I thought 18 years old, it's a small thing. How would have got cancer at 18 years old, So and then he said, let's just do a biopsy. I got admitted in December 9th. I did my biopsy. December 11th, I got the result. I was diagnosed with cancer. So usually biopsy takes about a week for to get the result. But my dad somehow did some magic. He speed tracked it for me. So I got it within 2 days. Yeah. And I was diagnosed with stage 3 nasopharyngeal carcinoma.
Alright, so before we go on to the next question, we are going to be taking a PSA break. Enjoy.
That definitely looks healthy. Yes, swap it. That's it. Now you know what to do.
Alright, welcome back from the PSA break. We are here back with Mr. Amir Dawood, who is really well PR trained, even though he's not an ICT student. He's a law student. He's a part of the PR family, the public relations family, through his work with his father. Mind explaining who your father is?
Yeah, okay, so my father is a former HRD Corp CEO, Dato Vira Shahul Daud, and he's currently the Group Managing Director and Chief Executive of Green Packets in Riyadh Berhad. Yeah.
So no wonder the medical thing gave us.
Yeah. Like you said, God is great.
God,
Yeah, God is great, yeah.
Alright, now let's move on to the second question.
Yep.
Alright, how did this diagnosis affect your daily life as a college student and your balanced life?
So, I mean, living with a as an 18-year-old, now you have a title, you're a cancer survivor, It's a proud thing to say to the world that, an 18-year-old has survived cancer. But when I go back to the beginning days, early days, I was completely shattered. I was completely broken. I was crying, in my room for about 2 weeks straight. Just thinking, why did God test me? Why did He give me this, diagnosis? What did I deserve? What did I do to deserve, to get this cancer? But then many people came and spoke to me. They said, God chose you because He loves you. You got this because He loves you. So I had to accept it. So it was all about acceptance. At the same time, how did it affect me as a college student? So year one, I barely go for classes like that. Don't follow me. Yeah, I barely go for classes. I was more on work and all. So I was like, okay, year two, we have to lock in. I wanted to go for classes. That's the time I got the news. I got cancer. I was totally broken. I couldn't go for my classes. I couldn't meet friends. I was isolated because I was immune prone. So I was very easy sick prone. So they had to isolate me. So I was living in Hayden for about almost 6 months, just at home among my family members. They also had to be very careful. So I couldn't have any friends nearby me. But one good thing was I had my parents beside me. They took really good care of me. They gave their best. They gave their best for me, no matter how much it was. They knew that I had to come out of this. And I also was very determined that I have to come out. I live for them, so I will come out for them. So that's when I was like, you do it, man, you do it. Yeah. And I think now I'm almost about 4 months cancer free. Yeah, and I'm just living with it. But at the same time, I have to be careful. What I do on a daily basis. No stress. Doctor strictly said no stress everywhere. No stress.
Can you tell any of your lecturers or classmates?
Early days when I got diagnosed, yes, I did tell a few of them just so that they're aware of why have I gone missing. So many people don't know actually that I got cancer. It was just when I did the Instagram posting where people found out that I have cancer. It's not something that you can go and tell people.
It's very private.
Yeah, it's very private. Yeah.
Very sensitive.
Yeah, right. Yeah.
Right, so let's move on to the next question, which is what was the toughest part of your treatment?
Dealing with chemotherapies and radiotherapies was the most difficult part. That's the first one. Second one was being with my family. So my treatment was in Singapore. So the only person I had by my side was my mom. And my dad was working, brothers are schooling, they can't come and go. So I had my mom, but she was a very big support for me. I definitely would be very grateful to her, She left her job, she left everything. Without a second, she came with me to Singapore. So of course, I did 10 cycles of chemotherapy with 35 cycles of radiotherapy.
Crazy.
And it was split into 2 phases. The first phase was only for chemotherapy only, where I did 3 cycles, just 6 chemo sessions. And then after they gave me about 2 to 3 weeks break so that I heal, recover properly. And then I did 35 cycles of radiotherapy. At the same time, I did chemotherapy. So it's like in a week I'm doing the radiotherapy the same week, one day I have to do my chemotherapy. So it was a double dose kind of thingy for me that week. So the first 2-3 weeks was okay. But starting the 4th week, I became weak. I started losing weight. I started losing my taste.
Did you feel like yourself after all this? After the 3rd week, did you lose yourself, or did you still felt that you were still there?
No, I felt I was still there. I didn't lose hope. I told my father I wanted to ask the doctor whether they can shorten the period of radiotherapy, because at that point of time my cancer 95% because of the chemo was already
Ah,
gone. So it was just only 5%. But the doctor said, yes, it was possible. You can bring it to 5 weeks. But if I do that, the chances of the cancer relapsing is very fast. And I wouldn't complete the treatment regime. So I was like, you know what? No. Emil, you've already fought it this much. You just have another 2-3 weeks left. Just bite the bullet and you can do it.
Yeah.
And I knew and I did it. Till the end, yeah. I didn't discard anything or
It's fine. It's fine.
Right, so
Wait, before you start, I want to ask, which hospital did you go to?
Oh.
in Singapore, right?
So in Singapore, yeah, for my chemotherapy, I was in Mount Elizabeth Novena. And under that, they had OncoCare. So I was under the care of Dr. Tan Chi Seng. He was in Johor, but he works in Singapore.
Damn, Johor.
Yeah, and then after that, I had for my radiotherapy, Dr. Sean. Yeah, both of them are very good. Yeah.
Are you still in contact with them?
Yes, of course. I keep updating about myself to them. You know, even now I'm actually having slight flu, and also I just update them to show that I have flu. It's because I'm still very early in as a cancer survivor. So
You're like a newborn baby.
yeah, and I have to keep track of what happens to me for the next 5 years actually. Yeah, so
every time you get like the flu,
yeah, every time I get like a flu or fever, I just have to update them so that they know, okay, I got flu this time. So because you might not know, this flu also can
Change it up.
touch wood,
Yeah.
but it can be a symptom of that as well.
Alright, so let's move to the next question.
Yep.
Alright. Who or what gave you the most strength throughout this journey? Now you mentioned previously that your mom was the main person that gave you the most strength throughout this journey. And you also mentioned that she left her job. That's a pretty big thing to
That's
do.
a
To
big
leave your
sacrifice.
job.
Yeah.
But that's what moms do for us, That's what they do. So yeah, please elaborate.
Okay, so of course, number one is always God. I prioritize God over everything. So it's like I said, God chose me because He loves me. So I accepted that, and yeah, I mean, when I went for the what I said, the pre-consultation before I started all the treatment, all the doctors really gave a list of what do you call that? Side effects. What I would go through during the treatment. I'm sure to say that I didn't even go through any of what doctors said. I didn't go through. It's all by the help of God. He minimized the side effects for me. Okay lah, the most basic one was throat pain because the cancer is around the throat area. So yeah, but even with that, I didn't go through much pain actually. He made it look very easy for me. Yeah, very simple. So of course, yeah, God is the second one. My father. I love him so much. And when I got the call from the hospital that I got cancer, the first thing I went and cried to was my father. He, of course, as a father, he can't cry in front of me. He has to stay strong. But I know the number of days which he has, crying behind. And at that point of time, he was at the peak of his job, so he couldn't leave. And he was a government servant, so it's very difficult for him. So we own a company actually. We own an events company. So my mom just left the company. She delegated the task to other people, let them handle it. So she came with me lah. But my dad he's working for others, so he can't, he can't spend a lot of time with me. So of course, he has guilt lah. That he couldn't be there. But I felt that he was one of the most major support for me. He was like, no, you can do it. I know you can do it. I know you will come out of it. Don't worry. Don't. I'm giving you the best treatment here. Whatever happens, we're going to come out of it together. Even though he was in KL, I had video calls with him every night. I spoke to him. He even went person contact with the doctor. He spoke with the doctors to give the best for me. Yeah. And of course, you have your family members lah.
Yes.
At that point of time, the doctor told you shouldn't be sad at all. Yes, you got cancer. Of course, people, it's mental. You mentally you get sad and all, but you should be happy. The more sad you are, the faster your health deteriorates, and the faster you
Yeah.
So the more happy you are, the more positive you are, or you can come out of it, and you're saying,
Touching on this, how how did you convince yourself that you had to stay strong? You know? So like, how did you keep yourself in check through the entire ordeal?
So this person really played a very important role in my life. Dato' Virali Chongwei.
Oh, Lee Chong Wei.
Yeah.
Lee Chong Wei.
The day I got the call from hospital that I was diagnosed with. So okay, a backstory again. I actually thought I got tuberculosis.
Okay.
The worst I could thought of is tuberculosis because I showed all symptoms of tuberculosis. But I didn't know there was a cancer called nasopharyngeal carcinoma, you know. And then after that, the moment I knew, the first person my father managed to get hold of was Dato' Virali Chongwei. He had the same cancer, same symptom as what I went through, the same place which I had the tumor yet he also had. I went and saw him. He told me, "This is all a small thing, don't need to worry." I was supposed to go to Taiwan first actually. He recommended me to go to Taiwan. He did the arrangements for me to go to Taiwan to do my treatment there, but Taiwan was a little bit difficult because of the food. A bit hard.
Yeah.
And Johor was near for us. So I can always travel and come back. If any emergencies, my father, my parents, family, anyone can come. But Taiwan was a little far. And if I was in Taiwan, I can't come back to KL at all.
You had to stay there.
I had to stay there for about 6 months solid there. But when I was in Singapore, I managed to came back. At least, every weekend, when I had a break during my chemotherapy, I came back. Yeah, so Dato' Virali Chongwei played a very vital role. The same treatment which he went, he also told me so he prepared me very well. He prepared me very well what I should expect and everything. So I was ready for the worst. Mentally I was ready for the worst, but yeah, Alhamdulillah, I didn't go through the worst.
Good. I like that. That is very cool.
Right, so
Yeah.
I love this talk. I
Yeah,
love the
it's like
energy.
really
I love the vibe. I
I
love
love
the
it.
energy that we're having right now.
But let me be positive. Just be positive. Of course, I was the first few weeks I cried. I was very negative. I was like, Emir, you're going 6 foot down, Emir. I thought that. I was like, that's it. Because not many teens have survived cancer. I don't know what's the rate like. But I thought, you know what? That's it, like, Emir is gone.
Yeah, in times like this, hope is all you can.
Yeah, and I mean, many people came and gave many different opinions of, you should do this treatment. Some people say, don't do chemo, you should go into Indian traditional medication. But too much of opinions, too much of views from other people. My father made it very clear, I'm going to go with one person, so I went to Singapore. So that's where
The most trusted one.
the most trusted one, yeah. And I was also very confident that the moment the first needle went in me, the moment I know the medicine is in me, I know I'm in a very safe hands. I know I 100% knew. You just have the gut feeling, that
I'm good. I got this.
yes, I know I got this. It's just that the first medicine has to go in very quick. Cancer spreads very fast actually. It's very rare when it goes very slow. But normal humans, this cancer spreads very fast. I was like, the doctors was like, if you would have came about 3 weeks, a month late, you'd have gone to your brains.
So by the time you were diagnosed, right, what was the percentage like of how it was all good?
I was stage 3.
That is the highest.
So in those cancer, they say they have up to stage 5. So stage 1 is like nothing.
Okay.
Stage 2 is like stage 1. Stage 3 is like stage 2. Kind of thing like that. So I was stage 3, almost going to stage 4 already. I didn't know that the cancer already spread to my skull. Based on the skull. My father, he did to me. Dia tak cakap. He didn't let me know. When I completed the first phase of the treatment, the doctor said, "Oh, your base of the skull looks clean." I was like, "Do I have cancer then?" Yeah, we hid it to you because we don't want you to be sad. Yeah. So
Are you like happy they hid it from you? Because
no, even though he hid it from me, by the way the doctor spoke, I can guess it out really, but I didn't show it to them like I know.
You could feel like they were hiding something.
Yeah, I knew.
Of course, in a good reason.
So they said my whole neck was already spread already. It spread to the lymph nodes. My lymph nodes. Yeah. And this cancer is not like where they can surgically remove anything or whatsoever. It was because the tumor was around here. And there were many nerves connecting to it. It's your optic nerve.
So there's like more risk to just.
There's a lot of, it's a big risk actually, yeah.
In the event that someone comes up to you,
Yeah.
wanting to know what he has to go through, what he has to expect, what would your advice to him be? What would you tell him to expect? What would you tell him to, remember constantly
What message would you like to share with other young people?
that goes through something similar like this?
First, have faith. Have faith in God.
That's the first one.
He's the best. Have faith in God. He can do wonders. He can do miracles for you. And then second, never give up, lah. Basically, just never give up. Be very positive. Know that you're gonna do it. Just know that you're gonna do it. Don't think a lot. And never listen to many people. Don't listen. Many people can come and say different things. Oh, you're gonna do this. Something's gonna happen. Don't do this. Don't do that. Blah blah blah. First, listen to your parents. They know what's best for you. They of course give you the right treatment. Just follow them. They will give you the right guidance. Listen to your doctors, of course. Have faith in God. And you can, in over a period of time, once you complete your treatment or whatsoever, you can see, how you become better. You yourself will gain the positivity along the journey, along the way of people. You will learn how to be more disciplined, how to take care of your health, more persistent. You will become more, how do I say, you start to pray more lah.
Okay.
Yeah, you become more. It will, because God told you. You have to be thankful to Him.
That's right.
Yeah.
Yeah,
You have to. You see, God. Even if you can't pray, you're not in a condition of where you can pray. Even if you take your hands and raise and you ask to God, He'll accept it. I know. I'll give you an example. When I was in the radiotherapy, the back then, they put the mask on me. You know how terrifying it is? It's very scared. It's like claustrophobic. And in that room, you have no others, no people.
It's just-
They control from the outside. I'm the only one in the room. And a very common side effect is, while I'm doing that treatment, was flu and nose block. Already wear mask, you cannot breathe, and your mouth is also shut. So how am I going to do that treatment? I always, before I go, I lie down and they put the mask. I pray, Ya Allah, just 20 minutes, allow me to breathe peacefully. I just have to go through this treatment and make it easy, because the proton beam therapy is very precise. So if they go wrong a little bit, also it can affect my other nerves. So they have to be very precise. And in order for them to be very precise, they have to set their controls properly. I have to cooperate with them. So I was afraid that, if I have nose block or burger, the treatment, they won't be able to do it. Man, in my heart, I was just praying, Ya Allah, please make it easy for me. I have to finish it in one go. I swear to God, the last 3-4 weeks, man, the moment I asked Him, every time He made it happen for me. Every time. Even during chemo also, when they choke, it's always pain. Amen and needles are very far. Amen and doctors are very far actually. I hate needles, but He made it very easy for me. I had no pain. I didn't go through much. Like I said, the most common side effect for chemotherapy is vomiting. But
You didn't, yeah.
I didn't even vomit once.
Like you said earlier, a lot of the side effects that were supposed to happen,
It didn't happen at all to me.
so you feel like God made it.
Yeah, it's all God. It's all God.
Made it a lot more easier for you.
Yeah,
That's really good.
yeah.
Alright, so
Forever grateful.
Yeah, forever grateful, definitely. Just be positive, never give up. And the world's battling cancer. You can do it, I know you can do it. I did it, so you can. Yeah, have faith in God. Yeah.
alright, so that is it for this episode of the T&D podcast. We're your hosts, Tishan and Darwish.
And first, thank you to our
Thank you so much for having
greatest
me.
guest.
To
Thank you so
Mr.
much.
Amir Dawood.
Thank you.
Thank you so much for joining
Thank you.
on this podcast.
Yeah.
Here's his Instagram if you're all interested. And yeah, thank you. And
you so
bye bye.
Bye-bye. Ciao.